The setting is a suburban clinic. Here 30-year-old parent is concerned about his son's forearm, which appears broken and swollen. He needs to know the possible treatments and if it will affect his future growth. The first task is to understand what exactly happened. And we need to tell him that his son got a green stick fracture which needs a plaster cast and sling to manage. Also explain that his future growth will not be affected and it will take approximately 6 weeks to heal completely. Also, tell him that he can do all the normal activities within the limitation of wearing the plaster. Let's begin the role play. Good morning. I am Giovanna, one of the registered nurses working in this hospital. How may I address you? Then the interlocutor may respond by saying, "Call me Tom." Then we can ask him, "Hello, Tom. You look so worried today. What is bothering you?" Then the interlocutor may tell you that, "Yes, nurse, I am worried about my son who got a fracture today morning." Then we can respond to him saying, "I am so sorry to hear that. Try not to be worried. You are at the right place. Okay. Can you please elaborate me a little more to understand the condition much better?" Than the interlocutor will tell you that, "Sure nurse, today morning he was playing with his friends in the park. And in the middle, he fell down on the floor and got a fracture and I can see it is broken and swollen too." Then we can tell him that, "Tom, I understand your concern. We can manage it effectively with some treatment measures. Is that okay? From the doctor's examination it seems to be a green stick fracture. Do you know anything about it?" Then the interlocutor may tell you that, "Unfortunately, do not know anything about that. Could you explain to me in detail?" Then we can tell him, "I'm glad to explain to you, Tom. A green stick fracture is common among children because their bones are softer and less brittle than adults. In this type of fracture, there will be a mild break in the continuity of the bone, but do not worry. We are here to support you." Then the interlocutor may ask you, "Nurse, what kind of treatment is available for this?" Then we can respond to him saying, "There is some definite management for green stick fracture. That is plaster, cast and sling." Then he may ask you, "If you don't mind, could you please explain to me in detail?" Then tell him, "Sure. I'm glad to explain it too. You plaster cast and sling are usually used to treat a broken bone. A plaster cast rigidly protects an immobilizing, an injured bone or joint. It holds the broken bone in proper alignment to prevent it from moving while it heals. They allow broken bones in the arm or leg to heal by holding them in place. Are you following me, John?" Then he may respond by saying, "Yes, being a father, I have some more concerns." Then we can tell him that, "Sure. Please explain your concerns." Then he may tell you that after the discharge what additional care should be given to my son. Then we can tell him that, "Yes, I really acknowledge your concern following the discharge. It is your responsibility to assist your son in doing his daily activities. Advise him to move his fingers to improve blood circulation and decrease swelling. Also ask him not to give too much strain to the injured hand. Finally, don't forget to give him the medications on time, which were advised by the doctor. Is it clear to you?" He may tell you that, "Sure nurse. I will." Then we can ask him, "Do you have any other concerns?" Then he may respond by saying, "Could you tell me what kind of diet he needs to follow?" Then tell him, "Your son has a fracture, so it is good to improve the intake of calcium rather than protein. Calcium is needed for growing and building strong bones and teeth during childhood. Also, it plays an essential role in many bodily functions, including recovery and repair of tissues. The major sources of protein and calcium which are required for bone health are meat, fish, milk, cheese, and nuts. Are you following me?" Then he may tell you that, "Yes, nurse. I understand that." Then we can ask him, "Do you have any more questions to be clarified?" He may ask you, "How long do we need to wait to get a complete recovery?" Then respond to him saying, "Tom, I acknowledge your worries. Normally it takes 6 weeks for a complete recovery, but it is very important to follow the medications and my instructions. Okay, then he may tell you that, sure nurse. I am ready to follow all your suggestions and instructions for my son's faster recovery. Then we can tell him that. I really appreciate your responsible approach. Do you have any other questions for me? Then he may ask you. Yes, nurse. Finally. I would like to know, will this fracture affect his future growth? Then tell him that absolutely it will never affect his future growth. Once he is completely recovered, he can carry out all his normal activities. Until then, please be patient and do not encourage him to do any rigorous activities. Okay, then he may tell you that, nurse. I'm very glad to know that. Then we can wind up our session by saying we have been discussing your child's current conditions and its management. So nothing to be alarmed about. If you have any more concerns, you can contact me at any time. I will be happy to assist you. Once again, I assure you that if you follow the instructions and medications properly, your son will be able to get back to normal life as early as possible. I wish your son